Good afternoon, everyone. Welcome to the Healthcare and the ADA, including People with Disabilities webinar series. I am Pam Williamson from the Southeast ADA Center, along with Ann Deschamps from the Mid-Atlantic ADA Center. We will be your moderators for today's webinar. This series of webinars is brought to you by the Pacific ADA Center on behalf of the ADA National Network. The ADA National Network is made up of 10 regional centers that are federally funded to provide training, technical assistance, and other information as needed on the Americans with Disabilities Act. You may reach your regional resource center by dialing 1-800-949-4232. Next slide, please. Now we're going to go through a few housekeeping items. So real-time captioning is being provided for this webinar. The caption screen can be accessed by choosing the closed caption icon in the meeting control toolbar. As always, in these sessions, only the speakers will have audio. Next slide, please. If you do not have sound capabilities on your computer or prefer to listen by phone, you may dial 1-669-900-9128 or 1-646-558-8656. The webinar ID is 894-2676-0110, and the passcode is 907078. Please note that this is not a toll-free number. This webinar series is intended to share issues and promising practices in healthcare accessibility for people with disabilities. This series topics cover physical accessibility, effective communication, and reasonable modification of policy issues under the Americans with Disabilities Act, also known as the ADA. These webinars occur every month on the fourth Thursday, every other month on the fourth Thursday at 2:30 p.m. Eastern Time, 1:30 p.m. Central Time, 12:30 p.m. Mountain Time, and 11:30 a.m. Pacific Time. By being here, you are on the list to receive notices for future webinars in this series. The notices go out 4 weeks before the next webinar, and the registration is open at that time. At the conclusion of today's presentation, there will be an opportunity for everyone to ask questions. You may submit your questions using the chat area within the webinar platform. The speakers and the moderators will address them at the end of each section, so feel free to submit them as they come to your mind during the presentation. Next slide, please. Again, you may submit your questions in the chat area box or press Alt-H and enter text in the chat area. If you are listening by phone and not logged into the webinar, you may ask questions by emailing them to adatech@adapacific.org. Next slide, please. If you experience any technical difficulties during the webinar, please send a private chat message to the host by typing in the chat window. You may type your comment in the text box and enter, or you may use the keyboard by pressing Alt-H to access the chat box via keyboard keys. You may also email adatech@adapacific.org or call 510-831-6714. This is both voice and relay. Today's ADA National Network learning session is titled Access to Medical Care and Medical Diagnostic Equipment Best Practices for People with Disabilities. The Americans with Disabilities Act covers doctor's offices, medical clinics, and other healthcare facilities. These facilities must be accessible to patients with disabilities. This training will discuss how to design and create accessible medical spaces, Also, the Access Board has published a final standard about access to medical diagnostic equipment for people with disabilities. These standards are for the Patient Protection and Affordable Care Act. And Bobby Stinnett, our presenter, will discuss the requirements for diagnostic equipment, including transfer and other mobility aids. And so now I'm happy to welcome our speaker for today, Bobby Stinnett. He is a accessibility specialist at the U.S. Access Board who provides technical guidance for design criteria to various stakeholders. His focus at the Access Board is on medical diagnostic equipment and healthcare accessibility. He has given many presentations to students, advocates, and professionals on accessibility issues and guidelines. He earned a bachelor's degree in human development from Howard University, a master's degree in clinical mental health counseling from Eastern Michigan University, and a certificate in trauma studies. He has over 15 years of experience coordinating a wide range of rehabilitation, counseling, and case management services focused on supporting disabled veterans and increasing access to mental health services. He is a licensed professional counselor, a national certified counselor, and an advocate for disability rights. Bobby, at this time, it is my pleasure to turn it over to you.
Okay. All right, thanks a lot. So we can go ahead and move on to the next slide. I think that's going to be the intro slide. We already did the intro, so we can move on to the next slide and go over the overview of the agenda for today's webinar. And so what I'm going to be talking about as it relates to this agenda, I'm going to be doing an overview of the ADA requirements for access to medical care services and facilities. Just really talking about access and being able to navigate the spaces. Also, I'm going to move on and talk about best practices for accessible examination rooms, best practices, and then requirements related to that as well. And so these things are really an important piece to be able to have and be able to look at sort of these best practices. And then also medical diagnostic equipment. I'm going to go over and talk about the standards related to medical diagnostic equipment, go over an overview and the technical requirements that are really, really important as it relates to how individuals navigate and use medical diagnostic equipment. And then, of course, at the end, I'll open it up to there's questions that you may have. And then, honestly, throughout this presentation, I'll stop and pause. And if there's questions that you may have, you can go ahead and ask those questions during the presentation because there's going to be a lot of information, okay? Okay, so let's move on to the next slide, slide number 9. And we're going to first start off by doing an overview of the ADA requirements for access to medical care and medical care facilities. Okay, let's move on to the next slide. Now, and this is slide number 10. So a really good document when you're looking at providing access to people with disabilities in medical facilities is this technical assistance publication that I show here on the slide, in slide number 5. Now, this document was developed by the Department of Justice and the Department of Health and Human Services. Now, this guidance focuses on access to medical care for individuals with mobility disabilities, like those who use wheelchairs, scooters, walkers, or crutches, or no mobility device at all. But when we talk about healthcare providers need to be thinking about more than just mobility disabilities. They need to be thinking about our individuals with hearing difficulties or who have vision impairments and other disabilities. Are they able to receive the proper medical services as well? And then also, as accessibility is not only legally required, it is important medically so that minor problems can be detected and treated before turning into life-threatening, like major problems. So this technical assistance document can be found on the ADA website at ada.gov. And I think it's a really very useful document as it relates to access in healthcare and healthcare facilities. Okay, so let's move on to the next slide, slide number 11. Okay, excuse me, slide number 6, I'm sorry. So for slide number 6, we're going to be talking about services and facilities. So when we look at services and facilities, the ADA requires access to medical care services and facilities where the services are provided. Now, when we talk about private hospitals or medical offices, those are covered by Title III of the ADA as places of public accommodations. And then also public hospitals and clinics and medical offices operated by state and local governments are also covered by Title II of the ADA as programs of public entities. Now, Section 504, it covers any of these that receive federal financial assistance, which can include Medicaid and Medicare reimbursements. Now, the standards adopted under the ADA to ensure that equal access to individuals with disabilities are generally the same as those required under Section 504 as well. Okay, so let's move on to the next slide, slide number 7. All right, so let's go over some of the general requirements. Now, I wanted to reiterate that again, that accessibility is not only legally required, it's important medically so that minor problems can be detected and treated before turning into like major life-threatening problems. So both Title II and Title III of the ADA and then Section 504, it requires that medical care providers provide individuals with disabilities full and equal access to their healthcare services and facilities. And then also it requires reasonable modifications to policies, practices, and procedures when necessary to make healthcare services fully available to individuals with disabilities, unless the modifications would fundamentally alter the nature of the services and or some of the essential functions of the service. Now, when we talk about reasonable modifications, this can be kind of challenging because reasonable modifications are really determined by the enforcing authority for the ADA, which is the Department of Justice. So if you have a question on what constitutes reasonable modification of a device or an area, that would be under the DOJ purview. Okay. All right. Let's move on to the next slide, slide number 8. So what I wanted to do is really kind of discuss some of the commonly asked questions that we get as it relates to access to medical care facilities. So just a quick note, now these questions are really from the technical guidance document that I mentioned earlier that was developed by the Department of Justice and the Department of Health and Human Services. Now, one of these questions that we get many times is it okay to examine a patient who uses a wheelchair in the wheelchair because the patient cannot get into the table or examine table independently? And the answer would be generally that no, that you cannot do that, but examining a patient in their wheelchair usually is less thorough than on the examining table. And then it does not provide like that patient with like equal medical services. And so there are several ways to make the exam table accessible to a person using a wheelchair. Now, a good option is to have a table that adjusts down to the level of a wheelchair, approximately 17 to 19 inches from the floor. Now, what is important is that a person with a disability receives equal medical services to those received by a person without a disability. Now, if the examination does not require that a person lie down, for example, an examination of like the face, then the exam table is not important to the medical care and the patient may remain seated. Okay, so let's move on to the next slide, slide number 9. And let's continue with another frequently asked question that we get. And so when we talk about one of these frequently asked questions, one question is it okay to tell a patient who has a disability to bring along someone who can help at the exam? And the answer to that is really no. But if a patient chooses to bring along a friend or a family member to the appointment, then they may do that. However, like if a patient with a disability, just like other individuals, may come to an appointment alone, and the provider must provide reasonable assistance to enable the individual to receive the medical care needed. Now, this assistance may include like helping the patient to undress and dress, or to get off and on the exam table or other equipment and lie back and be positioned on the examination table or other equipment. Now, once on the exam table, some patients may need a staff person to stay with them to help maintain balance and positioning. Now, the provider should ask the patient if he or if that person needs any assistance. And if so, what is the best way to help? Now, there are many more questions that I could go over, but I just wanted to highlight these kind of frequently asked questions. And really the takeaway from this is that medical care providers are required to provide equal access to medical care services to people with disabilities. Okay, let's move on to the next slide, slide number 10. And we're going to move on and talk about the best practices and requirements related to accessible examination rooms. All right, and we're going to move on and look at these requirements and how navigating this space is a really important piece and some of the requirements related to that. All right, slide number 11. Okay, so for slide number 11, we want to look at accessible examination rooms. So accessible examination room has features that make it possible for patients with mobility disabilities, including those who use wheelchairs, to receive appropriate medical care. Now, these features allow the patient to enter the examination room, move around in the room, and then utilize the accessible equipment provided. Now, the features that make this possible are an accessible route to and through the room, an entry door with adequate clear width and maneuvering clearance. It's important to really have access and maneuvering clearance on both sides of the door. And then also to have accessible hardware, and then appropriate models and placement of accessible examination equipment. And I'm going to talk a little bit later in this presentation about medical diagnostic equipment and how those need to be utilized and how they are in a medical setting as well. And then also the examination room needs to have adequate clear floor space inside the room for side transfers and then use of lift equipment. Now, if you have new and altered examination rooms, they must meet the requirements of the ADA standards for accessible design. Now, accessible examination rooms may need additional floor space to accommodate transfers. And then for certain equipment, like such as floor lifts or items like that. And so you need to have like that additional space. Okay, let's move on to the next slide. And the next slide is slide number 12. Okay, and we're going to be talking about entry doors for slide number 12. So under the ADA standards for accessible design, an accessible doorway must have a minimum clear opening width of 32 inches when the door is open 90 degrees. Now, maneuvering clearances on either side of the door that comply with the Americans with Disabilities Act standards must be provided. Now, in addition, the door hardware must not require tight twisting, pinching, or grasping in order to use it. Now, keep in mind that the hallway outside of the doors and spaces inside of doors should be kept free of things like boxes and chairs or equipment so that it does not interfere with the maneuvering clearance or the accessible route. Many times, one of the complaints that we get is that, you try to get into a space and then there's these boxes or trash cans are in the way, and it really makes it difficult to navigate and be able to use that accessible route to get into the room. And so it's important to remove those sort of barriers. All right, let's move on to the next slide, slide number 13. Now for slide number 13, we're going to talk a little bit about clear floor and turning space when we look at exam rooms. So in order for accessible equipment to be usable by an individual who uses a wheelchair or other mobility devices, and then people with disabilities in general, that individual must be able to approach the exam table and then any other element of the room to which the patient has access. So the exam table must have sufficient clear floor space next to it so that an individual using a wheelchair can approach the side of the table for transfer onto it. Now, the minimum amount of space required is that 30 inches by 48 inches. Now, the clear floor space is needed along at least one side of the adjustable height examination table. But because some individuals can only transfer from right or left side, so providing clear floor space on both sides of the exam table allows one accessible table to serve both right and left side transfers. Now, another way to allow transfers to either side of the exam tables, particularly when more than one accessible examination room is available, is to provide a reverse furniture layout in another accessible examination room. So we just encourage you to have like clear floor space on both sides of the examination table. Okay, let's move on to the next slide, slide number 14. All right, I wanted to show an image of what we need to be thinking about when we talk about access to medical care for individuals with not only just mobility disabilities, but individuals with disability in general. Now, these features of an accessible exam room include things like a clear floor space, that 30 by 48 minimum space that I mentioned before, and it needs to be adjacent to the exam table and adjoining the accessible route, and to make it possible to do a side transfer. Also, we need to be looking at having an adjustable height examination table that lowers for transfer as well. That's an important piece, to have a table that's adjustable. And then also being able to provide space between table and the wall allows staff to assist with patient transfers and positioning. So when additional space is provided, transfers may be made from both sides. And that's the benefit of having transfers that's clear floor space on both sides of the examination table as well. Now, also, we look at making sure that you have the amount of floor space needed beside and at the end of exam table will vary depending on the method of how the patient transfers, and then the lift equipment and the size that it's used. And so that will be determined in terms of the floor space needed. So I always say, I know spaces come at a premium, but the larger the space, the better, okay? And then also we need to be mindful of the accessible route and make sure it connects to other accessible, like public and common use spaces as well. That's just standard, making sure that it's on the accessible route. And then we need to make sure that the accessible entry door has a 32-inch minimum clear opening width, with the door opening 90 degrees. And so making sure that that entry door, that individuals are able to actually get into the area, and making sure that there's a 32-inch minimum clear opening width is an important piece as well. And then lastly, making sure that maneuvering clearances are needed at the door to the room. So getting into the room, and that's really key. Many times, there may be some obstructions in the way, or the doorway is you're not able to maneuver within. And this is really important in a medical setting and in a medical office particular, that you have proper maneuvering clearances, especially on both sides of the door. Okay, let's move on to the next slide. Just we stopped here. Let's just pause to see if there's any questions that may have come up.
I actually do have a question for you. Hi, everybody. I'm Ann Deschamps. I'm the director of the Mid-Atlantic ADA Center, and I'm happy to be here with Pam and Bobby. Okay. Ashley asks, what about weighing someone who is in a power wheelchair? Are there any special scales that each facility must have?
There's no special scales. We just say that if you're going to weigh them on the wheelchair, if you're going to weigh them on a weight scale, that make sure in terms of they have proper access, and if they have supports on each side, and that's what we say. But there's there's some special requirement for a scale. The ADA standards don't require anything special as it relates to that. We just say to make sure that you have proper supports on each side.
Okay, so as a follow-up question to that, then, if somebody in a wheelchair goes to a doctor and it's a normal part of the exam to weigh the patient,
yep,
as part of making their services accessible to people with disabilities,
Mhm.
do they need to have the um, the equipment and the facilities to be able to weigh somebody who's in a wheelchair?
You want to be correct. You want to provide equal access. So
Equal access.
if the examination, if it requires an individual to be weighed, to be weighed on a scale that's there that they have, and they need to transfer on that scale, and that's a requirement to be able to get a proper, measurement, then you can you can do that. But the standards in the ADA just say that you have to be able to provide equal access. So if it's important that if you keep that individual in the wheelchair and you roll them on the scale to measure them, if that's not going to be suitable to get the proper measurement, then that's not, you don't want to use that method. You want to be able to use the method that's going to give them the proper measurement for that individual. Okay.
Great. Thank you.
Yep. You're welcome. So can we move on to the next section, or do we have any other questions?
Okay. April asked, what if a small medical office does not have staff who can transfer someone with a disability safely from their wheelchair to a table? When is modification deemed unreasonable?
Yeah, this becomes a challenge, very challenging, because remember, one of the enforcement authority for the ADA is the Department of Justice. So what I would say, if you have an individual and you have like a small practice and you don't have like the necessary equipment to work with individuals who have disabilities, what's really important that you do is that you try to do modifications as best as possible to be able to get that access for that individual. So I would say, if you don't have the equipment, it would be important for you to try to assist that individual to meet, so that individual can have, the support that they need. Now, like I said, when we talk about modifications and what constitute a modification, a lot of this would have to be consulted with the Department of Justice to determine if the modification that you're providing is adequate enough. Okay, but like I said, it's a challenging thing, but I think it's important for you to have like a standard weight scale that individuals can roll on, and then you'd be able to do it that way. Because small practices I've been in, they have those type of weight scales where you can roll on the weight scale as well.
Well, and it sounds like what you're saying, it's really, how do you apply equal access to medical care?
Absolutely.
That concept, how is it applied? And I think there have been a lot of settlement agreements from the Department of Justice with healthcare entities that give good illustrations about how these concepts are applied in medical settings too.
Absolutely, absolutely. And so you need to be really trying to make sure that you're providing that equal access to those individuals as well.
Right.
Yes.
Well, I think we have some more questions, but why don't you keep going, and then
Sure.
when you get to a good stopping point, I'll come back on and get
Yep.
to additional questions. Thank you.
Okay, no problem. So I think because we're going into another area now, we're going to be talking about medical diagnostic equipment. And there's a lot of information as it relates to like some technical requirements. But as we move on to slide number 15, I wanted to just briefly talk a little bit about, MDE, medical diagnostic equipment, and really how to make these sort of equipment usable for individuals with disabilities. And so I'll be going over an overview of the medical diagnostic equipment standards that were developed by the Access Board. And then I'll go over and discuss the technical requirements of this standard as well. Okay, so let's move on to the next slide. And that's going to be slide number 16. And let me just go over a small brief history of the Rehabilitation Act. So the Rehabilitation Act, Section 510, mandated that the Access Board issue minimum technical criteria for accessible medical diagnostic equipment in consultation with the Food and Drug Administration. So this led to the Affordable Care Act, amending the Rehabilitation Act to address access to medical diagnostic equipment. Now, this slide contains a photo of President Obama signing the Affordable Care Act into law, and that was on March 23rd, 2010. Now, the ACA included amendments to the Rehabilitation Act, specifically Section 510, which mandates that the U.S. Access Board issue minimum technical criteria for accessible medical diagnostic equipment in consultation with the Food and Drug Administration. Okay, so let's move on to the next slide, slide number 17. All right, and let's continue talk a little bit about the Rehabilitation Act and what this means as it relates to medical diagnostic equipment. So the standards must ensure that equipment used in physicians' offices, clinics, emergency rooms, and things like hospitals and other medical settings are usable by individuals with disabilities, and then must allow independent entry to and then use of and exit from the equipment to the maximum extent possible. Now, the scoping or who must comply or when compliance is required, and then the minimum number to comply, that's really is to be determined by an appropriate administrative or regulatory context. So in other words, it's through rulemaking. So when another federal agency chooses to adopt the medical diagnostic equipment standards. Now, to be clear, the MDE standards are finalized by the U.S. Access Board, but they still remain voluntary until adopted by an enforcing agency like the Department of Justice under the Americans with Disabilities Act, or other potential agencies like the Department of Health and Human Services. Now, they can also be used by the Food and Drug Administration to verify labeling that claims that equipment is accessible. And then they also can be voluntarily adopted through policy. And I'll go a little bit more in terms of where we are as it relates to the medical diagnostic equipment standard a little bit later. Okay, so let's move on to the next slide, slide number 18. All right, so what do the MDE standards cover? So the MDE standards do not address the accessibility of the existing diagnostic equipment, nor do they require a percentage of new or replacement equipment to be accessible. The mandate in Section 510 specifically requires the Access Board to create the technical criteria for what medical diagnostic equipment should be and what it should look like. Okay, so let's move on to the next slide, slide number 19, which is the application slide. So the purpose of the medical diagnostic equipment standards is to ensure accessibility to and usability of the diagnostic equipment by patients with disabilities. Now, the standards are designed to provide for independent access and use of the diagnostic equipment to the maximum extent possible. Now, as I mentioned previously, the standards only apply only to like new diagnostic equipment, and that are based on patients' positions that the equipment supports during the patient transfer and diagnostic use. Now, the requirements for communication features or operable parts are only applicable where they provided for patient use. Now, communication features or operable parts that are used only by employees operating the diagnostic equipment are not addressed by the MDE standards. Okay, so let's move on to the next slide, slide number 20. And let's talk a little bit about the diagnostic equipment and what this really includes. Now, Section 510 specifically requires the following medical diagnostic equipment to be covered. So it looks at examination tables and examination chairs, including those used for like dental or optical examinations. We look at weight scales and mammography equipment, X-ray machines, and other radiological equipment. Also, per the definition in Chapter 1 of the Medical Diagnostic Equipment Standard, MDE is defined as equipment used in or in conjunction with like the medical settings by providers for diagnostic purposes. So the MDE equipment that you have at home is not under this, it's not required like in the standards. It's not a part of the MDE standards. And so this is for standards. This is all about individuals that are used in a medical setting, okay? And then some examples of like medical diagnostic equipment we have here pictured on the slide. And we include here a photo of a wheelchair user transferring onto an examination chair. And then we also have wheelchair user next to an MRI examination table. Also a rolling wheelchair accessible weight scale, and then a wheelchair user during an eye examination who is seated in a wheelchair with equipment on like an adjustable table that provides knee and toe clearance. So we have here on the lower right-hand corner at the bottom, that is an example of where an individual can roll onto the weight scale and be able to weigh that individual. And that's a typical weight scale. Okay. All right, let's move on to the next slide, slide number 21. Now, what do the standards not cover? So the medical diagnostic equipment standards, they do not include things like personal devices such as blood glucose monitors or positioning aids such as wedges or surgical or medical equipment, and instruments such as like stethoscopes or forceps or scalpels. Now, as I mentioned before, that if you have this equipment that you use at home, that's not really included as part of the medical diagnostic equipment standard. It's only for equipment that's used in a medical setting. Okay, so let's move on to the next slide, slide number 22. So I want to just briefly go over some of the measurements and dimensions, and this is pretty standard as it relates to the ADA. Now, when we talk about measurements and dimensions, these are based on adult anthropometrics. So the use of medical diagnostic equipment for children is not addressed in the standards, but may be addressed sometime in the future. Now, similar to the ADA dimensions, things that are not stated as maximum or minimum are considered absolute. Okay, so let's move on to the next slide, slide number 23. Now, for slide number 23, this really goes over what we talk about in section M201. M201 is the scoping section for the medical diagnostic equipment standard. Now, in M201, it states that scoping is to be determined by the enforcing authority. And then, as I stated earlier, potential enforcement authorities could be like the Department of Justice or the Department of Health and Human Services, or it could be adoption through policy. So currently the Department of Justice and the HHS, they have not adopted these standards, these MDE standards. But I do want to state that the Department of Justice and the Department of Health and Human Services do have addressing medical diagnostic equipment on their upcoming regulatory agenda for this year, which is really, really good news, because once this is adopted, or if it's adopted by one of the enforcement authorities, then MDE will be kind of the standard going forward as it relates to medical care facilities. All right, so let's move on to the next slide, slide number 24. All right, so for slide number 24, I think this might be a good place to pause, because now what we're going to be doing is we're going to be going into the various sections as it relates to chapter 3. Now, chapter 3 is the technical guidance or the technical area as it relates to medical diagnostic equipment and how a patient is positioned to use the equipment. And so I'll go over each of these areas, but before I get into that, I'll open it up to see if there's any other questions that we have before I go into this section.
Thank you, Bobby. We have a participant, Christine Fitzgerald, who wanted to voice her question. So Christine, if you are able, if you could unmute yourself and ask Bobby your question.
Great, thank you.
Sure.
So I just had a quick question. It's in relation to the accessible scales for folks using wheelchairs.
Yes.
I'm wondering if there's a way that we could develop a requirement that all medical facilities must have at least some form of cheat sheet to know what weight the chairs are? Because chairs do weigh different weights.
Yes.
And unless the person can transfer out of their chair into a regular chair, say seated on that platform, the individual may or may not know the weight of their chair, or they could give somewhat of a guess, but you know, in order to have the proper weight, that's really the only way you're going to do it, unless you're going to transfer that person over to a biomed.
Yep.
That can then weigh the person and get the exact weight of that individual.
You are absolutely correct. That is a great idea, and that's what medical facilities and offices should be like doing in terms of having some sort of, if they have this sort of scale, it's one thing that they should really be doing is being able to, because everyone won't know in terms of how much their particular device weighs, and so that should be something that should really happen. Now, when we talk about, requiring this to happen, I think right now, since these standards aren't, required right now, I think it would be something that would be done on a voluntary basis. But I think this would be something in terms of an advocacy piece to be able to advocate, to be able to have these, that sort of cheat sheet or that sort of document in these little offices. I think that's an important piece to, because you might not know what your weight scale is, how much that weighs, how much your device that you're using weighs. So I really like your idea.
Great, thanks.
Yeah, another participant commented that you have to be aware when you're looking at scales that weigh the wheelchair with the person, because some of them are very poor quality, some of them are great.
Calibrated right.
Just like anything else, it depends on the quality. But we have just a couple more before we move on. Assuming a compliant path of travel and parking, are staff expected to assist patients to get out of their vehicles and into the clinic?
Generally, no. The ADA standards wouldn't require you to assist staff to assist individuals to get into the clinic. Or the ADA wouldn't require you to do that. Now, there's plenty of medical offices that do that, that go above and do that assistance, but that's going to be on a voluntary basis if you decide to do that. Like I said, if whatever you can do to make it better or easier for that individual, I would encourage you to do that, but it's not required in the standards for you to do that.
Okay, and then I think this is an ADA 504 question. Does this information pertain to any civilian quote unquote medical facility as well as any Veterans Administration VA medical facility? There isn't really any difference between medical facilities, civilian or VA, is there? This was the question.
Yeah, this would still apply to those facilities as well. And so in terms of access, in terms of these sort of requirements, these would still apply for, federal or facilities as well. Yes.
Okay, great. Thanks, Bobby.
All right, we're going to move on then. We're going to move on to this section. Well, we're going to stay on this slide because let me just go over a little bit about what we're going to talk about in chapter 3. So remember, there are seven sections in chapter 3, which are really divided into 2 parts. Now, the first 4 sections can be devised based on the position that the patient is in during the use of the diagnostic equipment. Now, M301, that really covers diagnostic equipment used by patients that are in the supine, prone, or sideline positions. And then M302 covers individuals who are in a seated position, or remain seated, or are in a seated position. And then M303, it addresses equipment that is used by a patient that remains seated in their wheelchair. Now, M304 also covers standing positions, which is illustrated here on the slide. If we look at the bottom right of an individual who's standing on a weight scale and then holding on to horizontal supports. And then I'll just briefly discuss each of these patient positions first, and then go into a little detail about communication and then operable parts as well. Okay, so let's move on to the next slide, slide number 25. Okay, so first we're going to talk a little bit about when individuals access the equipment using the supine, prone, or sideline position as it relates to medical diagnostic equipment. Okay, so let's move on to the next slide, slide number 26. So when we look at the supine, prone, or sideline position, first, what are we looking at? There's some type of medical diagnostic equipment that are used in this sort of position, the supine, prone, or sideline positions. So the type of equipment covered under this section includes things like MRI machines or CT scans or examination tables and hospital stretchers. But it does not include examination chairs that recline. Examination chairs that recline, those are covered under section M302, which is when you're seated. Okay, and so those are the areas that when you're in the supine, prone, and sideline position that we're going to be discussing. All right, so let's move on to the next slide, slide number 27. And for slide number 27, I just wanted to briefly go over a little bit about the transfer surface and what the transfer surface should look like. And so the transfer surface should be height adjustable. So you measure the height from the floor to the top of the uncompressed transfer surface. So often medical equipment may have padding material on the examination surface that could be compressed. Now measurements should be to the top of the uncompressed surface. Also, the transfer surface must be adjustable in height to reach a high transfer position of at least 25 inches. Now, the transfer surface must also be able to reach a low position of no higher than 17 to 19 inches maximum. Now, this low transfer position is stated as a range currently. And I'll talk a little bit more about how the low transfer surface height and what that means on the next slide, because we're going to talk about what the low transfer surface height in terms of what that means going forward. Okay. So let's move on to the next slide. And the next slide is slide number 28. All right. So when we look at the transfer surface low position, here we're currently, as it relates to the low transfer surface height, the 17 to 19 inch low transfer height was set as a temporary range with the 5-year sunset provision, which expired on January 9th, 2022. Now, the transfer height was set as a minimum because there was insufficient information to designate a single minimum low height requirement. Specifically, there was insufficient data on the extent to which and how many individuals would benefit from a transfer height lower than 19 inches. Now, on May 23rd of last year, 2023, the Access Board published a notice of proposed rulemaking proposing a low transfer height of 17 inches for examination tables and chairs. Now, after we did extensive research and we gathered information and determined that 17 inches was the optimal low transfer surface height. Now, we also, the board submitted the final rule to the Office of Information and Regulatory Affairs for final approval of the low transfer surface height. And so where we stand right now is that this is still, the low transfer position is still that range from 17 to 19 inches, though the Access Board submitted a notice of proposed rulemaking through the Office of Information and Regulatory Affairs. And so we're just waiting for final approval. And hopefully when that's approved, then this last provision in terms of the low transfer surface height will be complete. And then the MDE standards will be totally complete. Okay, let's move on to the next slide, slide number 29. And let's talk a little bit about transfer surfaces. So when we look at transfer surfaces, there are two types of transfer surfaces. We have in transfer surfaces and side transfer surfaces. Now, an end transfer surfaces is defined as a transfer surface located at one end of the examination surface that allows patient transfer at the end and one adjoining side of the examination surface. Now, the diagram labeled end transfer surface shows arrows indicating that a transfer direction, one area is located at the end or the foot of the examination table, and the other arrow indicates a transfer direction coming from the side that adjoins the end. In this case, it is the left side. So it could also be the right side though. So a side transfer surface is defined as a transfer surface located within the length of the examination surface that allows patient transfer on two opposing sides of the examination surface. Okay, so let's move on to the next slide, slide number 30, and let's talk a little bit about transfer surface size. Now, the transfer surface needs to be at a minimum size that that complies with an end transfer or a side transfer. Now, transfer sizes are measured from the center points of their opposing sides. Now, often equipment has rounded corners or tapered edges, which could be difficult to measure. Now, measuring from the center line of the surface area simplifies compliance. So briefly, an end transfer surface must be at least 28 inches wide and then 17 inches long. And then a side transfer surface must be at least 28 inches wide and then 28 inches long. Now, the side transfer surface can be anywhere within the length of the examination surface that allows patient transfer on two opposing sides. Now, it does not need to be towards the top or the bottom. It can be at any location within the surface area. Okay, so let's move on to the next slide, slide number 31. And let's talk about some of the exceptions that we have for transfer surfaces. So there is an exception to the size of transfer surface for imaging equipment with bores, those hollow parts that are inside the tube of like a machine like this, like an exam machine. So an example of this type of equipment would be like this MRI machine that we showed here on the slide. Now, in this case, the width can be as narrow as 21 inches minimum, but no less than the full width of the examination surface provided. Okay? All right, so let's move on to the next slide, slide number 32. So slide number 32, I just wanted to briefly talk about transfer surface and the unobstructed transfer surface. Now, as noted here on the slide, each transfer surface should provide two unobstructed sides for patient transfer. Now, for side transfer, this would be the left side and right side. And then for end transfer, this would be the end, either the left or the right side. Okay, all right, let's move on to the next slide, slide number 33. All right, so for slide number 33, I wanted to talk about transfer surfaces and how you are permitted. There are some obstructions that are permitted. Now, in terms of these permitted obstructions, obstructions are permitted to extend on the transfer side beyond the transfer surfaces provided that they do not protrude above the tops of transfer surfaces and less than 3 inches deep. Now, this essentially allows equipment to protrude beyond the transfer surface, creating a gap of up to 3 inches that the patient needs to transfer over. Now, transferring over a gap of this size is consistent with existing research and the requirements in the ADA standards. Now, temporary obstructions are also allowed, provided that they can be repositioned during transfer. So some types of temporary obstructions you may come across would be like supports and railings that can be raised or lowered. And so those are permitted as long as they can be repositioned. Okay, so let me move on to the next slide, slide number 34. And for slide number 34, I wanted to talk a little bit about these transfer supports and go a little bit in terms of the location. So transfer supports, including those supports required at transfer surfaces, are like leg supports or which are required where stirrups are provided. and then head and back support where diagnostic equipment is used in a reclined position. So transfer supports need to be provided at a specific location along transfer surfaces. So for in transfers, the transfer support should be provided on the short side of the transfer surface, opposite of the transfer side. So it is allowable to have a maximum gap of 1.5 inches between the transfer surface and the transfer support, which is measured horizontally from the nearest edge as well. Now, also, side transfer surfaces should have transfer supports located on the opposite side of the transfer sides, and supports should be removable to permit unobstructed transfer from both transfer sides. Okay, let's move on to the next slide, slide number 35. Pam, you think this is a good way to stop right here? Is there any questions you think I should answer right now?
Yeah, because related to transfer, I
Yeah.
work in an ambulatory surgery center. In general, we are willing to offer minimal assistance to get from wheelchair to bed and bed to wheelchair, but we do not have a Hoyer lift or a slide board. Would it be inappropriate to ask patients who need maximum assistance to transfer to have their procedure at a hospital where they have this equipment?
So if your place of your medical facility doesn't have the equipment to be able to have individuals transfer on, and it seems like it's going to really be required for them to transfer onto that space or that table in order to get the examination, what we would say is that, you know, you have to, you want to be able to provide access. And it's not, if an individual cannot transfer, or if you don't have the equipment to be able to transfer the individual, then, you know, what would be there, I mean, the standards would say that you can't, you know, discriminate, or you can't not, you know, you have to be able to try to provide support for that individual. But if you cannot do that, then what we're required to do is you would need to be able to provide some sort of modification or some sort of assistance to try to address that, and to be able to make sure you're trying to address that so an individual can be able to get the medical care that they need. Now, if it comes to a point where you just don't have the equipment and there's no way that you're able to have this individual, you know, be properly examined, then if there is another place that they can go to, and then that's what they may have to do, that's what may has to happen. But you really want to be able to provide some sort of modification to address that individual so they can get the support that they need for that examination.
Yeah, and I think this underscores the need for healthcare providers to educate themselves about the different equipment and tools out there, like slide boards and Hoyer lifts and other equipment available that can help them provide equal access to their services for people with disabilities.
Because the equipment is available out there for you to be able to do that. It's just a matter of being able to have that in your facility so they, you know, you can be able to provide that service to individuals, because that's going to be needed. Yes.
Well, and educating yourself about the different types of equipment and what is available out there, I think is really, really important, especially with today and technology today and all the things that are coming up.
Absolutely.
Okay, another participant has a question about access to breast MRI for persons who have physical disabilities like a spine injury. Are you going to be talking about this? Are there any positioning aids or bolsters that can help facilitate that access? Speaking of tools to help with that.
I'm going to be talking about in a little bit later in this presentation about breast platform machines. I'm going to be talking a little bit about that in terms of like how to use and some of the, in terms of the equipment piece, in terms of how to be able to access that, you know, there is, I think it goes back to that whole thing in terms of the education piece and being able to, like, because they're educating individuals on, like, there is things that can help you be able to navigate that as well. And I think that's an important piece. Yeah.
Okay, great. Thanks,
Okay.
Bobby.
All right, so we can
They're coming in, so there'll be
keep them
more.
coming, keep them coming, keep them coming. I'd rather answer questions than all this technical stuff is readily available on our website. So any questions you have, I'm sure happy to answer them. Okay, so let's move on to the next slide, and we're going to move on to slide, I think we're on number 36 now. Yeah, slide number 36, and we're going to talk about transfer supports, and we're going to go over one of the exceptions that we have. And so one of the exceptions for transfer supports are for these wide imaging exam surfaces on very large exam surfaces where the width of the imaging bed is greater than 24 inches. The transfer support can be 12 inches long minimum. Now, this is because on surfaces this large, like the transfer support opposite the transfer side, may be more difficult to reach and possibly not be used by the individual transferring onto the surface. Also, when the transfer supports are in the use, the tops of the gripping surfaces must be between 6 inches minimum and 19 inches maximum. Additionally, technical requirements for gripping surfaces. I'll talk a little bit about this later in the training, just briefly. But now the transfer supports that we have, they do not need to be horizontal. They can, but they don't need to be horizontal. Okay, let's move on to the next slide, 37. And I'm just going to briefly, on the topic of lifts and portable lifts and lifts in general, I'm just going to briefly go over some of the basic requirements. So when we talk about portable lift capabilities, or excuse me, portable lift compatibility, on slide number 37, we look at, like, when we talk about like individuals who are in a supine, prone, or sideline position, it must be compatible with like portable patient lifts. While the lift itself is not covered by the MDE standards, the equipment it is used on is covered, and you want to be sure that it is compatible. Okay. And so when we talk about like lift equipment or lift compatibility, we're going to be looking at what we call in-base clearance and then around base clearances as well. Okay, let's move on to the next slide, slide number 38. I'm just going to briefly go through these really quickly. When we talk about lift compatibility, we have clearance in base, and that clearance in base needs to be the 6-inch high minimum, and the depth is the 36-inch depth in terms of minimum depth. And in terms of the measurement, it needs to be measured from the edge of the examination surface and extend the full length if it's less than 36 inches deep. And so the important part is when we look at like the clearance in terms of lift compatibility is that clearance like in base and what the measurement should be. And then the clearance when we have it around base and what that measurement should be. Okay, so let's move on to the next slide, slide number 39. So for slide number 39, lift compatibility, it's the same thing in clearance around the base. So for clearance around the base, we look at the same thing where we have the 6-inch high minimum, and then the 36-inch deep minimum is measured from the edge of the examination surface. And then also when we have that 26-inch wide minimum is permitted to increase at a rate of 1 inch width for each 3 inches in depth. And that's when we talk about the clearance at around the base and what that should be in terms of being able to access in terms of that lift. Okay, let's move on to the next slide, slide number 40, and we're going to talk about overhead lifts. Overhead lifts, there's an exception for like overhead lifts, where fixed overhead lifts in terms of patient lifts are provided and the user is permitted. And this is really when we talk about from the enforcement authority. So, you know, depending on like if this lift is, if it's like an overhead lift and it's fixed, you know, these are usually exempted depending on the enforcement authority. Okay. All right, let's move on to the next slide, slide number 41. And when we talk about slide number 41, I wanted to move on to the next way an individual is positioned. And so we're going to talk about seated when you're in the seated position. All right. So let's move on to the next slide, slide number 42. So when we talk about the transfer surface needs to be height adjustable. All of these requirements that I just went over in M301, which when you're in the supine, prone, and sideline position, are really the same when you're in the seated position. And so the transfer surface, we talked about that it needs to be height adjustable. And also it needs to be measured from the floor to the top of the uncompressed transfer surface. And then we talked about the high transfer position at the 25 inches minimum. And then there's a range between the low transfer position between 17 to 19 inches maximum. And then there's an additional 4 additional transfer positions located between the low and high pieces that are separated by 1 inch minimums as well. And so this is really similar and it's the same as it is in the supine, prone, and sideline position. Okay, let's move on to the next slide. Slide number 43. So for slide number 43, the transfer surface size in terms of how it should be measured, the transfer size is going to be required to be 21 inches wide minimum, and then 17 inches deep minimum. So this size of the transfer surface is required to be measured from the center points of their opposing sides as well. Okay. Let's move on to the next slide. Slide number 44. All right. So slide number 44, when we talk about in the seated position in M302, when we look at lift compatibility, it's the same requirements as M301 when you're in the supine, prone, and sideline position. So we're looking at making sure that the clearance under base of the lift, clearance around the base, and then there's also, like I said, the overhead lift exception as well if you're in the seated position. Okay, let's move on to the next slide, slide number 45. Okay, so for slide number 45, we're going to move on to the next positioning. This is when you're seated in a wheelchair, all right? So I began the webinar when I looked at positioning in the supine, prone, and sideline position, and then I continued with M302 when you're in the seated position. Now we're going to move on and move forward with the requirements if you remain seated in your wheelchair for examinations, which this is in section M303 of the MDE standards. Okay, let's move on to the next slide, slide number 46. And let's talk about wheelchair spaces. So before we were talking about sitting on the equipment, now we're talking about remaining in the wheelchair. Now, this part of the standard in section M303, it addresses the requirements when you remain seated in a wheelchair. Now, the orientation should be designed so that a patient seated in a wheelchair orients in the same direction that a patient not seated in a wheelchair orients when using the medical diagnostic equipment. Now, the image on the slide, you have an individual using a wheelchair that's pulled up underneath an eye examination equipment and then remaining in the wheelchair for like the examination. So in this exam, the requirement is really that you have to simply, it can be pushed out of the way and the patient can wheel up to the equipment. So in that case, this would be the type of equipment that M303 would apply to. And then also as shown here on the image, the orientation is designed so that a patient seated in a wheelchair orients in the same direction that a patient not seated in a wheelchair orients when the medical diagnostic equipment is in use. Okay, so let's move on to the next slide, slide number 47. Okay, so we're just going to kind of pick up where we left off. And I think I was on we're on slide number 47. So I'll just go ahead and continue with slide number 47 and talking about wheelchair space width. And when we look at wheelchair space width, now the fundamental requirement in this part of the standard is for what we call wheelchair space. Now, wheelchair space has to be at least 36 inches wide, but the manner of entry to the space will change its depth or length. So we have one where you enter the space from the front or the rear, And then we also have a length requirement when you enter from the side, and then a depth requirement when you can pass through from one end of the wheelchair space to the other. Now, here on the slide, we have an example of a 36-inch wide and 48-inch deep space where you can enter from the front or rear. So you basically enter from a point and then exit from that point. And then you have the side space where you have a depth of 60 inches minimum. And then also, when you have a pass through, then you have to have that 40-inch minimum space as well. And I'll talk a little bit about the pass through weight scales a little bit later. Okay, so let's continue and let's move on to slide number 48. All right, so when we talk about wheelchair spaces and clear floor space, now I want to be clear that we're talking about spaces where you are remaining seated in your wheelchair. So we are not talking about providing spaces for wheelchairs where you would be transferring from your device onto the chair. So we don't address clear floor spaces necessary for transfer in the standards, but we're just talking about remaining in the wheelchair. And as we show this indication here on this slide. Okay, let's move on to the next slide, slide number 49. Now, for slide number 49, when we look at wheelchair spaces on weight scales, this is one of these questions have already been brought up in this webinar, but we have like addressed the type of equipment, and we've done it really in a couple of ways so far. First off, we have like in the right-hand corner up here, we also have like an image of a pass-through weight scale that I mentioned earlier. And it still is that 36-inch wide, but it's minimum depth of like 40 inches. So when you can pass through from the front to the end, you can make the space shorter, which is often the case with these small portable platforms. Now, we also have an exception for the width of wheelchair spaces on raised platforms. Now, the pass-through depth I talked about earlier that applies to any situation or equipment, raised or not. Now, the exception for a raised platform is equipment when you are raised up and have a wheelchair space. And then basically, if there is no obstruction higher than 4 inches above that 36-inch clearance, then you can reduce that down to 32 inches minimum. So essentially what we're saying is that you can reduce that if there's no obstruction higher than 4 inches, then you can reduce it. Okay. All right, so let's move on to the next slide, slide number 50. You know what? Can we go back to slide number 49? Let's go back to slide number 49 real quick, if you can. Okay, so for slide number 49, I just wanted to mention one other piece that in terms of this image, like when we look at the image on the lower right-hand corner. So this image is of an elevational view, which kind of really puts all of this together of how these requirements will really be helpful when you have a weight scale situation. So you can see in the diagram of the person, or we show in the diagram of a person in the wheels and toes, and it's directing beyond that 40-inch minimum that I mentioned earlier, with really little impact on the usability of the equipment. So you can have that, like, it's not really affecting the usability of that equipment when they have those toes that detect beyond that minimum area as well. And I just wanted to note that. All right, so let's move on to the next slide, slide number 50. Now for slide number 50, I wanted to talk a little about clearance beneath like components. So we talked about wheelchair spaces. Now, the next important thing is the fact that you may have to deal is with knee and toe space or clearances. So where wheelchair spaces are entered from the rear, and it includes a space beneath components, the knee and toe clearance that is essentially the same as they are in the ADA and the ABA standards must be provided. So you will be providing a knee space that is very much like you would have in like an accessible lavatory or work counter. And again, here on the slide, we have an image of an individual that is pulled up to the eye examination equipment. And this would probably result in a knee space that is similar to what I mentioned earlier in like an accessible like lavatory or work counter. Now, on the slide, we have a diagram also of these requirements in detail. Now, one of the takeaways from this slide is that most equipment as it relates to knee and toe space will be essentially the same as it is in the ADA standards. Okay, so let's move on to the next slide, slide number 51. And let's talk a little bit about breast platforms. Now, there are some important deviations from this standard, and that's the equipment as it relates to breast platforms or mammography equipment. And this is addressed differently because of the nature of its use. Now, it requires pulling up to the machine to a chest point in a way that is certainly not like using like a countertop. So it is a very different dynamic. Therefore, we have increased the depth of the knee and toe clearance, both at the top and at the bottom, to permit you to really jam yourself up against the surface. Now, for the breast platform itself, we do have a requirement that it be adjustable and have an adjustable height from 26 inches to 42 inches minimum above the floor. And then you have to have at least to have it adjusted in that minimum range as well. Okay, so let's move on to the next slide, slide number 52. And let's talk a little bit about breast platform clearances on slide number 52. Now, another unique concern about this equipment type, like mammography equipment, is that it has very cantilevered entries for like the breast platform. And this, of course, causes a tipping forward issue for the user. So as a result, a lot of equipment is designed to have a flange to come out at the base and counteract this motion. Now, additionally, technicians or healthcare professionals, they need to access to readouts and controls at the base of some of these types of equipment. So for these reasons, we permit an area in the knee and toe clearance where components can extend into its profiles no higher than 1.5 inches with a little bit of taper at the back. Usually, we don't allow anything to violate knee and toe clearance at all. But in this case, because of the deeper nature of the knee clearance and the data we reviewed on footrests, it was determined that this would be permitted. Okay, so let's move on to the next slide, slide number 53. And let's talk about the last little area we're going to go over, which is standing positions. Now, standing positions, because we talked about already positions in the supine, prone, and sideline positions. We also talked about in a seated position and then when you transfer onto a surface. And then we also talked about requirements when you remain seated in a wheelchair. So the focus up until now has been about people using mobility devices. And now we come to our final equipment category, which is standing positions. Okay. So let's move on to slide number 54 and talk about standing positions. So for standing positions, it's a little bit different. So it's intended for people who ambulate with a mobility disability or otherwise have a balance or steadiness concern while they are standing. So the requirements are pretty straightforward. So you have to have like a slip resistant surface and provide standing supports to each sides of the surface as well. Now, these supports can be horizontal or they can be vertical. Either one is suitable. Okay, let's move on to the next slide, slide number 55. Now,
Bobby, I just wanted to give you a heads up. We've got about 4.5 minutes left.
Okay, I figured that I was going to stop here because I think we might be running a little late. So let me, the rest of this information, like I said, when we talk about standing supports, those is pretty standard as it relates to just not making sure things are slip resistant and making sure that you have supports on both sides. And then if we move on to the next slide, slide number 56, it's really the same thing. You can have the wheel on if you roll onto the stand, if you have the standing supports, that you just have access, and then you make sure that you have supports on each side and have that gripping surface of 80% of the platform length as well. And then the next slide, slide number 57, is really just about leg supports and head and back supports, making sure that you provide those, because those are really, really important as it relates, to access. And then slide number 58, as we move on here, is really about communication, making sure the equipment, that there's information provided in at least 2 of the 3 methods, which is audible, visible, and tactile. So you need to provide at least 2 ways of communicating. And then we move on to the last slide, slide number 59. This is all about operable parts, making sure that if there's any operable parts, that the features are addressed. They have to be tactily discernible, operation, and then operating force, and making sure there's not a lot to be able to operate that operable part. Okay. And then we move on to the last slide, slide number 60. This is just the slide showing that if you want a copy of the medical diagnostic equipment standards, then you're able to get this at our website at accessboard.gov, and then go to MDE, and then you're able to get the full medical diagnostic equipment standards. Okay. All right. That's it. I'm really sorry about the technical difficulty. I'm really sorry about that. But if there's any time for a few questions, I'm happy to answer any.
Well, Bobby, unfortunately, we don't have time for additional questions today, but I do thank you for your excellent presentation. And as you know, we've had a lot of people ask excellent questions. So if you'd like to follow up with your regional ADA center, you may contact us at 1-800-949-4232. You also have Bobby's contact information there. 202-272-0021 for his phone number, and Stanette at access-board.gov is his email address. Now, you will receive an email with a link to an online session evaluation, and we would please ask that you complete that for us. We want to make sure that we see your input and that we can continue to make our programs better. And again, we want to thank Bobby for being with us today and sharing his time and knowledge with us. Thank you for attending today's session, and we wish you a wonderful rest of the day.
Thank you.
Thank you, Bobby.
Thank you.